It gives me great pleasure to preside over this auspicious occasion whereby we are launching the third generation County Integrated Development Plan, CIDP 2023 to 2024. This launch marks a huge milestone towards the achievement of our vision of being a county enjoying improved productivity through the maximum realization of its potential for sustained economic, social, and political development. Chapter 11 of the Constitution of Kenya establishes devolved governments whose objectives are to promote socio-economic development and the provision of proximate and easily accessible services throughout Kenya. The Constitution further sets out the distribution of functions between the national and county governments. Recognizing such provisions of the law, we are happy to launch the third generation County Integrated Development Plan, CIDP 2023 to 2027 for Kirinyaga County. The CIDP provides the integrated development planning framework, which is the sole basis for preparing county budgets. It is expected to contribute to the realization of the aspiration of Kenya Vision 2030 and its medium-term plans, bottom-up economic transformation agenda, BITA of the Kenya Kwanza government, and the Sustainable Development Goals, SDG, at the county level. Allow me to thank the county executive team for their contribution during the consultation, compilation, and publishing of this plan. I would like also to especially thank the County Assembly for their input in the development of this plan and its approval. I promise that we shall work together as a team to deliver the development agenda for Kirinyaga County as outlined therein. Ladies and gentlemen, this CIDP draws its development agenda, as you have heard, from the Vision 2030, the bottom-up economic transformation agenda, and the county sessional paper 2032 in the views of the public gathered during various public participation forums held across the sub-counties in November 2022. Despite the scarcity of resources, we shall endeavor to equitably allocate the available resources to ensure equitable development across the county. We shall also enhance effective and efficient monitoring and evaluation systems that will see to it that the projects are implemented within the given timelines. This plan outlines the implementation of programs and projects in the next 5 years with 5 strategic goals. The first goal is job creation through the creation of new industries and product diversification. Better health through accessible and affordable healthcare is the second strategic goal. The third is increased income from improved and efficient agricultural productivity, market access, product marketing, and competitive market prices. Number 4 is urban planning, infrastructure to create state-of-the-art towns and cities. And number 5, enhanced knowledge and skill development to establish demand-driven, adaptive, diligent, talented, and unique workforce. In the last 5 years, we have done many projects which have been in line with the first CIDP. Allow me not to read all of them because there are very many. We all know that in health, we have built our flagship project. Our flagship project in health has been the construction of Kerugoya Level 5 Hospital. The hospital, which is ready for opening, will enable our residents to access the specialized services for which we have always been referred to other hospitals, such as in Embu or in Nairobi, Kenyatta National Hospital. We have an outpatient department that offers specialist consultancy in pediatrics, ENT, oncology, dermatology, orthopedics, medical outpatient clinic, surgical outpatient, neuropediatric clinic, obstetrics, and gynecology. I'm almost becoming a doctor. The inpatient wing has 341 bed capacity which includes 15 ICU beds, 6 HDU beds, female and male surgical wards, a maternity, a newborn unit, and a pediatric ward. It has 4 fully equipped brand new theaters. All the beds in this facility are connected with medical gases to enable crucial medical care at the bedside. I would like to confirm that we have recently been given the date of the launch by His Excellency the President. And very soon we will be telling you which that date is. I have not even told my team the date, but we will be seeing His Excellency the President. Will be very honored to host him to open for us our facility of Kirinyaga'a Level 5 Hospital. We also know that we're in the process of upgrading Kimbembe and Kirinyaga'a Hospital. And instead of giving very many stories, I just want to confirm that last night, because of the efforts of looking for resources, we got a private sector partner who has promised that as soon as I've finished the Kimbembe Hospital in the next 3 months or so, they will fully equip it to the level of Kirinyaga'a Hospital. So the only thing I'm remaining is that I'm looking for another partner to now help me from the private sector to equip the Kirinyaga'a Hospital. We know there are no resources, but we don't sleep and say there's no resources. What we do is that we work night and day to look for our friends and our partners. When we are not here, we are talking to them, we are going for meetings, enabling them in their CSRs to help us where we cannot reach. So even if we have scarcity of resources, those are from where, and especially the who are served by Kimbembe Hospital as their level 4, which is going to be the level 4. When you hear people talking about the old hospital, waambie wangoje. Itakuwa same standard as the Kirinyaga'a Hospital. You have heard that we have had very many programs on Wezesha. We have supported over 50,000 households. In the new Cidp, we hope to go to over 100,000 households in various projects and value chains, like poultry, tomato, avocado, dairy, fish farming, beekeeping, and pig rearing. As you have heard, even with the program on poultry, and even the ones of the pigs, mutigakirie gukushiothe na nguruwe, let us use them to build our own incomes within our groups, even when we give the resources that we are giving. In trade, you all know that we have built 15 markets. We are now in the process of finishing 4, and there is 5 more. 5 or 4? 5 more that we are starting to do this financial year. In fact, we will be finalizing with the members of the County Assembly where we are building those markets just now before they leave. But we did not stop there. We have worked, as you have heard. We said we are going to have Ndia as our industrial city. We have set aside the 250 acres of land, which look like a dream, but we are in the process of building our industrial park for Kirinyaga'a. I would like to confirm and to thank sincerely His Excellency the President for the support that he has given us, and he has chosen Kirinyaga'a County to be the pilot rural EPZ in the country. Even as I speak, I know my team and the team in the national, they have not been sleeping, because tomorrow in the newspaper will be the advertisement by the national government of our county aggregated and industrial park, which is the first phase of setting up the industrial park, and also the EPZ will start, we expect, in the next 2 weeks. So combining what we are doing at the county level and supporting the better economic model of His Excellency the President, and I thank the County Assembly, because when I told them we need to put money, because the national government is putting 250, and we're required to put 250 minimum. They have supported us and ensured that in the budget we have enough resources to start off the industrial park in Sagana. On infrastructure, you have heard on the projects of Kabro. We can't talk too much about it. You know about Kagio, Kutus, Kirinyaga's. Now, as we speak, we're just about to sign off Kabros for Kagumo and Kabros for Sagana area. We are also working to see how we can get partners to support us on the various requests that we have been asked for the various towns in the county. On education, we had in the past constructed 33 ECD centers and also built several, about 17 TVETs. Again, yesterday, I was looking for resources. We are getting support from Nairobi for one digital lab, which we have selected, a digital lab for a school, which we've selected Kiamogumo Secondary. And then we are also going to be getting free Wi-Fi for a town, which I have selected Kagio, because Kagio is really growing. And on both sides of the town, you have Mwea on one side and Dia on the other side. So to balance off the support I'm getting from other partners, I have taken the free Wi-Fi project to Kagio to enable industries to operate and our young people to start establishing business centers in that area. And there'll be many other things that we'll be discussing. In lands, there are various initiatives of lands recovery, but one of the main ones is the low-cost housing. In Kirinyaga's, we've already given the land to the national government to do the low-cost housing. We gave the land 6 acres, and when the president comes to launch our hospital, we will also be doing an official groundbreaking for the low-cost housing in Kirinyaga's, which have already started, which is in about very soon. I don't want to tell you the date. We will tell you the date as the day becomes nearer. We also will be having low-cost housing in Mwea. We have chosen Mwea West and Mwea East, and also we have chosen in Sagana at the industrial park. There will also be low-cost housing. So there will be a lot of development in Kirinyaga's, and we hope that this CIDP will build on all the things that we have been planning on in the last 5 years. In gender, youth, and sports, our department has set aside for our women and our youth, but mostly our women, 70 million shillings to start a fund that will be given to women groups for biashara. So wale ambao hawatakuwa wamepata hustler fund, kutakuwa na fund ingine Kirinyaga, so that we can supplement and support what the president is doing, and we have started off with 70 million shillings. The same in sports and in ICT digitization, we are progressing as is in the CIDP. Today we are also gathered here to launch the NARIG Phase 2 project, Wezesha Kirinyaga Group, and today we are here to release funding for 146 community interest groups, and the funding is totaling 53.2 million shillings. The funds are to benefit farmers across various value chains, the ones we mentioned: tomato, avocado, dairy, beekeeping, and incubators, dairy, goats, amongst others. The project aims at empowering the beneficiaries to make at least 1,000 shillings per day. And through Wezesha, from the beginning, we have so far been able to disburse 344.3 million, with Kenya shillings 225.3 million supporting 619 groups in those value chains, and 119 million went to support producer organizations in dairy, avocado, tomato, and poultry. We have prioritized various various value chains. Tomato has 19 groups, avocado 21 groups, dairy has 20 groups, beekeeping 20 groups, incubators 26, and dairy goods 40 groups. All of that coming to 53.2 million shillings. These groups are divided into various sub-county. Ndia has 21 groups, Kirinyaga'S Central 28, Geshogo has 34, and Mwea has 63. As you can see, the distribution is in line with our population. We are not favoring one county vis-a-vis another. Mwea has 2 sub-counties, Mwea East and Mwea West, and in terms of population, it is the most populous in Kirinyaga, and also if you look at the demographics of the area, and that is why it has 63 groups in Mwea. The dairy groups is to increase milk production. Avocado is to increase avocado production. I have seen in their plans, they have given me a number of 25,000 seedlings for hash and fuete. Nimewaambia that is not acceptable. I have told them to increase the seedlings to 200,000 seedlings. And there is a way to do it without spending too much money. If you get our young people and you get them the materials they can propagate for us, so that you get the seedlings at a lower cost, and therefore you're able to spread the seedlings to a lot more people. So the CEC Agriculture amesikia ya kwamba nimesema tuongeze seedlings za hash, avocado na fuete kutoka zile target walikuwa wameweka ya 25,000 to 200,000 seedlings.